Who should get the TB vaccine and when? The tuberculosis vaccine, known as Bacille Calmette-Guérin, or BCG, is an important tool in preventing TB, especially in certain populations. It is primarily recommended for children who have a negative TB test and are at high risk of exposure to adults with untreated or poorly treated TB. This is particularly crucial when children cannot be separated from these adults or when long-term preventive treatment is not possible. In cases where children are exposed to TB strains that are resistant to common treatments like isoniazid and rifampin, the BCG vaccine may also be considered. However, in the United States, routine BCG vaccination is not recommended. This is mainly due to the low risk of TB infection and the variable effectiveness of the vaccine against adult pulmonary TB. For healthcare workers, the decision to receive the BCG vaccine should be made on an individual basis. This is especially true in environments where there is a high prevalence of drug-resistant TB strains and ongoing transmission. In such cases, healthcare workers should receive counseling about the benefits and risks of vaccination, as well as treatment options for latent TB infection. It's important to note that BCG vaccination is not suitable for everyone. It is contraindicated for individuals who are immunosuppressed, such as those living with HIV or those who are candidates for organ transplants. Pregnant women should also avoid the vaccine due to a lack of sufficient safety data. In summary, the TB vaccine is mainly recommended for children at high risk of exposure who cannot be protected by other means. It may also be selectively offered to healthcare workers in high-risk settings. The ideal timing for vaccination is before or during periods of continuous exposure. Decisions regarding vaccination should always be made in consultation with TB experts and local public health authorities. This approach aligns with public health guidelines that emphasize targeted vaccination rather than universal immunization in areas with low TB incidence. Always consult with healthcare professionals for personalized advice regarding vaccination and TB prevention strategies.